Lawrence General Hospital's orthopedic program, I think, sets the bar very high in the Merrimack Valley. So what we do that's different is we work collaboratively. We have a nurse navigator for you. We have rehab. We have everything that you need right here through the hospital.
I think it's invaluable to patients to have one entry point into the system and a system that carries them through in a nice systematic fashion that's reproducible and it answers all their questions up front. Patients have a lot of questions and a lot of fears and worries, as one would expect, because it's a big thing to undergo.
The joint program is designed to allow patients to transition smoothly from one step to the next. In the beginning, prior to having surgery, a patient will attend a Joints in Motion education class, and they will also receive a home visit where a therapist comes to their home and evaluates the home safety. The next step in the process following the surgery would be a physical therapist coming in and seeing them while they're in the hospital, and generally this is twice a day, to start them with exercises and to get them standing, getting them up out of bed and walking.
I think a lot of patients still have sort of an outdated idea of how joint replacement works and what the recovery is like. And so what's changed is what we do with blood loss issues with surgery, pain control with anesthesia and medications in and around the time of surgery, physical therapy, advances that have been made really over the last 5 or so years that have enabled patients to recover at a much quicker rate.
Our patients really enjoy Joints in Motion class, and really starting that education at the forefront so they can prepare themselves makes surgery a little bit less scary for them and makes them feel like they are a part of their care plan.
That they're coming into an environment that isn't foreign to them, that they are already prepared for it.
And so when they know what to expect ahead of time, they're sort of mentally prepared for what's going to happen, and it just makes the entire process, I think, easier from their standpoint.
It's one of the main features and most intriguing features of the whole program is that it's individualized for that patient. And so there's a certain systematic process, but each patient goes through it in a little bit different fashion that really addresses their needs.
When you come here to Lawrence General, we ensure that you have services at home if you need them. We ensure that you have outpatient therapy when you need it. We talk to you about the proper medications you should and shouldn't take preoperatively and postoperatively, and we really work tirelessly to make sure that there's continuity of care, and I think that's really important to patients.
I think the beauty of a community hospital is it's a much smaller entity, so when I operate on somebody, I see them the next day, I see them every day that they're in the hospital. There's fewer patients on the floors, there's more nurses. I know all the nurses, I know all the therapists. Much easier communication in a smaller setting.
Here at Lawrence General Hospital, we're behind every patient 100%. We want to see you succeed, and it's incredibly satisfying for us to see you go through the process and get back to doing what you enjoy doing best, to get your life back.